In the spirit of reconciliation, DHSV acknowledges the traditional custodians of the land that we are filming on and their connections to land, sea and community. We pay our respects to the elders past and present and extend that respect to all Aboriginal and Torres Strait Islander peoples today. Welcome to the DHSV Coffee Catch-Up series, where we shine a light on key oral health issues to spark discussions that lead to change. Oral health is essential for overall health and well-being, with poor oral health linked to a range of chronic diseases, including heart disease, diabetes, respiratory infections and malnutrition. If we're serious about improving the health outcomes of Australians, we need to prioritise and integrate oral health care within the broader health landscape. Today, I'm joined by Kylie Woolcock, who is going to talk about why a connected healthcare system is crucial for improving oral health outcomes and revolutionising care delivery. Kylie is the CEO of the Australian Healthcare and Hospitals Association, Australia's national peak body for public and not-for-profit hospitals and healthcare providers. Kylie has worked in the health sector for over 20 years, starting her career as a pharmacist before moving into health workforce development, health policy and reform. She's passionate about reorientating the health system to achieve the outcomes that matter for people and their communities. Kylie has postgraduate qualifications in health economics, artificial intelligence, training and management. She's a visiting fellow at the Faculty of Health at Queensland University of Technology and a member of the International Hospital Federation Governing Council. So welcome Kylie, thanks for joining me here on the couch. So we talk a lot about the importance of getting rid of silos in healthcare, and yet the ivory tower still exists. And what are some of the challenges or the key challenges or barriers to creating a more connected healthcare service in Australia, do you think?
I guess I would start by saying there's an awful lot of activity happening in the national policy environment at the moment. It's all really exciting and important policy. And when we look at those policies, there's a broad range of them, from the governance of at the top level between the states and the Commonwealth, the governance that's happening between LHDs and primary health networks at the moment, the governance that happens on the ground when you introduce team-based models of care. We're seeing changes in the data and the performance information that's available to people to make decisions. We're seeing changes in the workforce and in the way in which they're regulated and trained. We're seeing changes in the funding models, and all of these things need to be implemented by services and professionals on the ground, and services that are really already stretched. So the extent to which we can support our workforce to implement some of this reform is really going to be critical to achieving some of the potential that these policies are being introduced for.
Yeah, it's interesting, it feels like, and this could just be my glass half full idea, is that it feels like we're on the cusp of something really quite substantial in healthcare, that there's a lot of will to make a healthcare system rather than a siloed set of individuals trying to do the best that they can do, both from a federal and a state level. So I think it will be interesting to see where that heads to next. And as you say, there's a lot of work happening on the ground with individuals, but also from that high level view. What do you think some of the strategies or approaches that we could implement to foster better communication and collaboration? Because as we know, none of this gets done by ourselves. It all has to be done in partnership.
We really need to be creating that environment for teams to come together, and it's challenging. And as we move forward, we really need to think about teams that can look very different, not just in terms of the patient needs that are being addressed or the care needs, or whether it's acute or chronic care, but thinking very broadly about what that workforce looks like in that team, but also, how are we embedding, new digital technologies as part of that team. We know that people's care needs are going to be quite variable, and we tend to introduce, universal policies for how we deliver care, and that's really important to have, in terms of ensuring, a level of equality. It's important from an administrative burden perspective. And so really balancing what is a universal policy, but how do we actually address care needs and be a little bit more flexible on the ground to make sure that people are getting the care that they need. And that can be more care, but it also can be allowing people who are capable of self-managing. How are we using digital technologies? But not even that. I mean, there are some great examples now of, for example, call centres. You've got a person on the end of the line providing a service, but overlaid with that is artificial intelligence being used to monitor for distress. So the burden's not on the individual to detect that, but there's a technology in place, and that can lead to an escalation pathway. And I think when we start to think really innovatively about what that is, and when we start to then examine policies, we think of the team very broadly, and not limit, I guess, what it is that the system is essentially capable of.
I think the traditional, going back to the previous conversation around silos, I think that traditional hierarchical, almost the white coat syndrome conversation is no longer fit for purpose in the way that people want their healthcare delivered. We have a community, I think, who are much more understanding of what it is that they need, and also much more willing to speak up about, this is the outcomes that I'm looking for, not just going, oh yes, yes doctor, that's exactly what I need. So I think I find it fascinating. I think the next couple of years are going to be really quite interesting. With most advancements, technology and data play a really important role. How can we harness some of that technology and that data? Because I think there's going to be such large amounts of data, and I'm not sure that we've got the skills and capabilities to be able to actually utilise that to its full advantage. Do you see that there's ways that we can actually help the system do that?
Yeah, I think coming into it with purpose.
Yeah.
So we do know, and that can create an enormous burden, I think, particularly on service providers who have access to the data, but is it the right data at the right time for them to make a good decision? And equally, is it given to people to give it to so they can make good decisions themselves about their own care? And so I think as we develop interoperability, if we achieve that even within the system, it's not going to be enough. It's about how do we select the right data? Are we measuring really what matters? And are we collecting it in a way and sharing it in a way that people feel like that it's meaningful to them? And I think that's, whether it's the patient or the clinician, it has to be meaningful to them, and they need to receive and see that impact that they're making in the decisions they're making.
Yeah, I think people are more than happy to provide data if they know it's going to be used for something, or collect data if they know it's going to be used for something. I think, traditionally we've kept a lot of information and data and just put it in, I don't know, in a cupboard somewhere, that we haven't actually utilised it to change the system or change our decision making. So I think there is a massive opportunity for us to do something different in that space. And as you say, using artificial intelligence to support that, but also using, people who do data analytics for our living, rather than, us trying to get a clinician who's a clinician, trying to understand what those big data sets tell us.
And that's really difficult, I think, when we've got such a diverse health system. It's one thing to have the infrastructure that sits behind some of our hospital systems, but our primary healthcare system is a large number of small businesses. So how do we support them to understand their data and to use it in a way that's meaningful to them?
Totally. Are there any policy or regulatory changes needed to support the creation of a more connected health system, do you think? And if so, how would we actually know which ones are the right ones and deliver that effectively?
I think there are lots. But I think there are lots of opportunities. And when I mentioned those 4 sort of domains that we think about policy in, I think, the first one starts at the top with that agreement between the Commonwealth and the states and territories. And, it's those agreements have been in place since before Medicare, and they really did start around hospital funding and have had that focus all that time. But for a long time it's been recognised that health systems will naturally gravitate towards a more specialised and hospital-centric mode of healthcare, if that's what we let it do. So how do we go into those agreements with a fundamental shift in thinking, to think about and allow and support preventative care? Not to say that hospitals aren't important. I mean, they're critically important, and they have a really important role in supporting, I guess, at the community level, how we shift that care to be preventative. Workforce, I think, is a critical one. We do think about workforce. I mean, we count our workforce in silos. How do we think about our workforce? So there's a lot of work, I think, to be done in how we examine our workforce and how we understand it. And, with digital technologies, just geographical distribution is not going to be sufficient for understanding whether the workforce is sufficient for meeting community needs.
Do you think there needs to be a shift in the types of workers that we have in the system? You know, we've got the traditional, you know, doctors, nurses, allied health professionals. Do you think there needs to be different levels within those craft groups?
Absolutely. I mean, I think we need to be thinking quite creatively and you know, really recognising the expertise that different people have within the workforce and supporting them to use that expertise. I mean, you know, I'm sure everybody knows themselves how much more supported and how much more they enjoy their work when they're in a supportive team.
Yeah.
And so if we can create those environments and you know, recognise the importance of the administrative workforce and our assistant workforce, you know, the digital support that could become, you know, those are going to be critical to any delivery of healthcare. And I mean, I know myself, I value those roles incredibly in my own role.
Yeah, absolutely.
So, yeah, I think there's a broad workforce. And, you know, it's the connection across not even within the healthcare system, but how do you, you know, value the work that's done by those in the community and care sectors as well.
Yeah. I think we need to be looking at, you know, it's not just about healthcare, but it's about health and care. So how do we actually shift that conversation to something in a whole different world? All right. Are there any last question. Can you think of a recent example where collaboration and integration between healthcare organisations led to an improved health outcome?
There are so many, so many. I think you know, and you know, COVID brought so many of them out. You know, we saw the public and private partnerships in the hospital sector. We saw, I think, the introduction of medical student, final year medical students being allowed to work in a paid role within hospitals, and that required collaboration across the education providers, the accrediting colleges, the hospitals, the state government, the regulators. We saw the collaborations between, you know, private primary health networks and the LHDs or hospital sector to develop those COVID pathways, or the community health services. There are just so many, you know, but aside from COVID, you know, we have the wonderful work of Professor Kelvin Kong that I was just reading about in terms of supporting, you know, remote Aboriginal communities and, you know, preventative health around hearing loss. We've seen, I mean, the list just I was speaking to someone the other day around a mental health service that collaborated with a second-hand clothing store to support, you know, clothing when people were sort of turning up in hospital unprepared, which has benefits for the patient, benefits for the budget, benefits for the environment. I think our real challenge is that we're actually not great at scaling and spreading a lot of this innovation. And so how do we support our workforce to understand what's being done and what's being done well, and really have some clear measures that enable that, and, you know, understand what the context is that they're being successful in so that people can adopt them.
What do you see, this is a random question that's not on the list of questions, but what do you see as the AHHA's role in actually helping support some of that breaking down of silos, or, you know, uncovering those innovative models that are occurring around the country and bringing them to light? What do you see the AHHA's role in that?
You know, we can have a really big role because we do come with a membership that spans the whole public health system. So we don't come with a preconceived idea of what's best. Supporting groups to understand and learn from each other, and it's not within, I think we've got a history of learning within our silos, so professions learn by profession, and it's really important that we come together and understand and learn from across the sector, you know, whether it's about how do we best measure outcomes, how do we support that cultural shift, or, you know, how do we engage with, you know, executive, with management, with digital, with, you know, across those broad teams. And I think those are things that can't be done in silos, and I think that's why AHHA has a really important role in facilitating those conversations.
Excellent. Thank you so much for joining me on the couch today. Good luck in your role as the CEO of the AHHA. Massive agenda ahead, and I look forward to seeing the outcomes that are occurring.
Thanks so much for having me.